My name is Jackie C. and I'm a dietitian at Mayo Clinic. I often get asked by people with celiac disease if they should follow the FODMAP diet. Before I answer that, I would like to explain what the FODMAP diet is for those of you who are not familiar with it. FODMAPs are certain carbohydrates found in foods. These carbohydrates do not digest completely, and then they ferment by bacteria in the digestive tract, causing gas, bloating, and sometimes diarrhea. For what it's worth, FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. These carbohydrates are found in wheat, onions, garlic, milk, legumes, high fructose corn syrup, apples, and many other foods. The FODMAP diet is an elimination diet to determine food intolerances in people with irritable bowel syndrome. It requires that you eliminate fermentable carbohydrates, or FODMAPs, for 4 to 6 weeks and then reintroduce one food at a time to see if your symptoms recur. Now, back to the original question. Should people with celiac disease follow the FODMAP diet? The FODMAP diet does not treat celiac disease. I just want to make that clear. The only treatment for celiac disease is a gluten-free diet. However, if you are on a strict gluten-free diet and you are still having GI symptoms, you may be a candidate for the FODMAP elimination diet. Before you try the FODMAP diet, be sure to discuss it with your physician, who will want to do some tests to make sure your celiac disease is well controlled and that your symptoms are not caused by uncontrolled celiac disease or another serious condition such as a pancreatic disorder or colitis. The FODMAP diet may be more appropriate for people with non-celiac gluten sensitivity. People with non-celiac gluten sensitivity do not have celiac disease, but their symptoms improve on a gluten-free diet. Some studies suggest that it is the FODMAP in wheat, rather than the gluten, that is responsible for the symptoms in people with non-celiac gluten sensitivity. And in fact, non-celiac gluten sensitivity may be a form of irritable bowel syndrome. So, if you have non-celiac gluten sensitivity and your symptoms are not completely controlled on a gluten-free diet, you may benefit by trying the FODMAP diet. Whether you have celiac disease or non-celiac gluten sensitivity, the trial may be more successful if you work with a registered dietitian who can make sure you are doing it right and getting a balanced diet.